It started with a toothache, a dull ache in his lower jaw that he ignored for 3 weeks. By the time he walked into the emergency room, he couldn't open his mouth, he couldn't swallow, and his airway was closing. 19 years old, college student, no medical history. 3 weeks ago, his lower right molar started aching. He took ibuprofen, then more ibuprofen, then he stopped eating on that side. 2 days ago, his jaw swelled. Yesterday, the swelling spread to his neck. This morning, he woke up and realized he couldn't swallow his own saliva. His roommate drove him to the ER with a towel under his chin. The ER physician opens the curtain and sees it immediately. Bilateral submandibular swelling. The entire floor of his mouth is pushed upward. His tongue is displaced, forced backward toward the back of his throat. She asks him to open his mouth. He can barely separate his teeth. Trismus. The muscles of mastication are in spasm. She palpates his neck. The swelling is woody hard, not fluctuant, not soft, board-like. She reaches for the phone and calls 2 people, anesthesia and oral surgery. She does not call them calmly. Here is what she understood in that moment. A dental infection had escaped the tooth. It spread from the periapical space of the mandibular molar into the submandibular space. Then it crossed the midline. Then it dropped into the sublingual space. When infection occupies all 3 spaces, submandibular, sublingual, and submental, bilaterally, there is a name for it: LUDWIG'S angina. And the danger is not the infection itself. The danger is what it does to the airway. The floor of the mouth is swelling upward. The tongue is being pushed backward. The supraglottic tissue is becoming edematous. His oxygen saturation reads 94%, 93, 92. Every minute that passes, the window for a controlled intubation gets narrower. If that window closes, the only option left is a surgical airway, a scalpel through the neck, cricothyrotomy in a 19-year-old because of a toothache. Anesthesia arrives, fiber optic nasal intubation. The tube passes through the nose, down past the swollen tissue, and secures the airway. The team exhales. IV antibiotics begin, ampicillin sulbactam, covering the polymicrobial flora of the oral cavity, streptococci, anaerobes, bacteroids. Then the CT scan, and it confirms what everyone feared: a large multiloculated collection in the submandibular and sublingual spaces, gas bubbles visible in the tissue. Gas in soft tissue means one thing: tissue necrosis. He needs the operating room tonight. In the operating room, oral surgery performs incision and drainage of the submandibular space. Purulent material, thick, foul-smelling, drains freely, over 40 milliliters. They trace the infection to its source, the right mandibular second molar, tooth number 31, a periapical abscess that had been brewing for weeks, silently eroding through the lingual cortical plate of the mandible, seeding bacteria into the fascial spaces of the neck. One tooth, one ignored toothache, 40 milliliters of pus, and a near-fatal airway compromise. LUDWIG'S angina is not a sore throat. It is a surgical emergency. The classic presentation: bilateral submandibular swelling, woody hard in duration, elevated and displaced tongue, trismus, dysphagia, and a voice that sounds like the patient is holding a hot potato in their mouth. The number 1 cause: odontogenic infection, most commonly from the mandibular second and third molars, whose roots sit below the mylohyoid line. Below the mylohyoid means direct access to the submandibular space. No anatomical barrier, a straight highway from a rotten tooth to a neck. He spent 4 days intubated in the ICU, 7 days of IV antibiotics. The molar was extracted on day 3. On day 10, he walked out of the hospital, a scar on his neck, a story he tells carefully. He had been afraid of the dentist. He had avoided that appointment for 2 years. The copay was $40. The hospital bill was $92,000. A toothache is never just a toothache. The floor of the mouth is millimeters from the airway. What starts as pulpitis becomes periapical abscess, becomes fascial space infection, becomes Ludwig's angina, becomes a surgical airway or a death. Respect the tooth.